You're watching TV9 News and I'm Prajwal D'Souza. As India is coping with the second wave of COVID-19, concerns are being raised on the third wave and the possibilities of it affecting children. A few days ago, Chief Minister of Delhi Arvind Kejriwal had warned that the central government that a variant found in Singapore might result in fueling the third wave in the country. The Chief Minister also said that the variant is found to be extremely dangerous for children. Earlier in May, Kejriwal, who is the principal scientific advisor to the Prime Minister Narendra Modi, had suggested that the third wave was inevitable, but later added that it can be avoided through strong measures. Trying to allay the fears of the third wave affecting children, the director of AIIMS, Dr. Randeep Guleria said, and I quote, "There is not enough evidence to say that the third wave is going to predominantly affect children. I think even in the coming wave will be protected because of the very nature of the virus that it causes less infection in children." Dr. Guleria was quoted as saying by News 18. The doctor also assured that measures were being taken to protect children from the virus. As warnings are issued over the potential third wave, Delhi's Lok Nayak Hospital has reported 4 times higher admission of COVID-affected children in the age group 8 to 15. A report by Times of India added that the hospital has also added 6 extra pediatric ventilators. But is it a cause of worry? Will the third wave affect children the most? Here is what Bengaluru-based Dr. Karthik Nagesh, the chairman of Manipal Advanced Children's Center in Bengaluru, has to say. Doctor, what precautions should be taken by the parents and health authorities
to prevent such a catastrophe occurring in children? It's well known and we ought to be aware that children are not really adults who are small. They have their own physiology and the disease pathology may afflict them in a different way than much what we can fathom. So we have to be prepared for any eventuality. Children are also unique in the sense they cannot be really deprived from the care of their parents or other caregivers, and therefore when a child falls ill with corona, it's likely that even parents can get afflicted and parents need to be the primary caregivers if the child needs care and hospitalization. Keeping this in mind, health authorities have to prepare a very robust pediatric COVID task force in the state or in the smaller towns and cities of the state and be prepared for this menace in the next coming months. This would mean, in addition to ramping up infrastructure facilities in the existing hospitals, we would have to probably create corona care units for children and mother dyad. We have to possibly take into consideration that the mother and the child cannot be separated.
Are there any variants that particularly affect children?
I do think, and it's quite plausible, that the third wave is likely to affect children more in the coming few months if we are not adequately prepared for it. It is basically quite likely that the new coronavirus mutant strain, which is the B167, is probably likely to afflict children more, and we have to be mentally prepared for that, and we should possibly put up into place and ramp up all facilities to be able to tackle this menace. There is now enough evidence that the current strain of B167 is afflicting children more than earlier it was seen. In fact, if we see the data which is emerging now in the state of Karnataka where I work, more than 40,000 children have been afflicted in this last 1.5 months alone, which is much more than the numbers which are afflicted throughout the whole of the last year in the first wave. Though the infectivity of the strain is seen to be more this time, afflicting more children, but children are not falling that sick. I would say for every 100 children who are falling ill with the coronavirus,
several countries have approved vaccination for kids. Should India now fast track a vaccine for people under 18?
The government sector and in the private sector to be able to look into these matters and can be an advisory for this. The other thing which needs to be ramped up soon as possible is to improve vaccination services for the adults in the family. I'm sure the government is trying its best to get as much vaccination as possible done. Particularly, it's being recognized in this second wave now that children are getting afflicted because of infections coming through adults. Children are not going to school, they're sitting at home, they have not been exposed to any other children as well. And in the earlier wave, we had suspected that children may be the carriers of this infection to adults. So hence schools had been stopped. But if you see now in this last 2 months or so, most of the children who have got afflicted have got it from the adult caregivers at home. So if the adults, especially parents of children, were to be vaccinated soon as possible, this drive, if it happens very fast.
The second wave is not yet over, and now that the reports of a possible third wave are emerging, it is important to follow all the safety protocols to stay safe from the coronavirus. If you like this content, do give this video a big thumbs up and don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and stay safe.